Hi, I'm Dr. Nishant Yagnik. I'm a specialist brain and spine surgeon. And today I'm going to tell you what we mean by rare complications. We had this lady who was middle aged. She was on blood thinners and she had a very severe disc problem. Her disc had suddenly ruptured and the disc in the lower back had started pressing the nerve, causing severe sciatic pain. She was just crying out in pain. None of the painkillers were working, and we did a microscopic disc surgery. We went in, removed the portion of the disc that was outside, and we repaired the disc with a special device called an RF. And what happened after that was she was absolutely fine. She was walking immediately after the surgery. She was walking at home. She was very, very happy. 10 days later, she came back for removal of stitches. She was still very happy. 2 days after that, she comes back with the same kind of very severe pain. Now it's on the opposite side. And we did an MRI and we found out that the same disc had ruptured from a different point. The same disc had ruptured earlier, it was on the left, for example, now it was on the right, and now it was compressing the right sided nerve. This is really rare. There are complications in which the disc can come out from the same location, which we have repaired, because the repair is still not as good as a normal disc. It takes time to fibrose and heal. And if the patient does heavy work, which this patient did actually, the recurrence can happen. But in this particular patient, that area was absolutely fine. This was a completely new area that had ruptured. And when we explain this complication, the chances of it happening from a new area and the same disc this early after surgery is maybe less than 0.5%. That's 1 in 200 patients. And so we don't get to see these complications very, very often. But it happened in this patient. 1 in 200 means that it is going to happen. It is a known complication because someone has seen this before and someone has mentioned this before, and we are supposed to tell the patient. So we went back in. I realized that because of her blood thinning, she also had connective tissue disorder, which she didn't know about. It was an autoimmune disorder, something where the immunity attacks your own spine. That made the disc even weaker. We found the new point, sealed the new point, and this time we just replaced the disc completely because it was terribly damaged. It just comes to show that every time you read online that there are rare complications to a surgery, remember they're there because they've happened, and they are exceedingly rare. And not having the surgery sometimes is definitely worse than risking those rare complications. But we get to see them because of the volumes that we operate.